So I'm going to introduce Greta Macaire, who's well known to many folks in this audience as a dietitian up at UCSF, gives a great talk right before lunch on sort of diet and nets, and we love having Greta here. So thanks again for coming.
All right, well, thank you for having me. It's always a pleasure to be here. So I'm going to talk for the next 30 minutes. I know you're getting hungry, but just to get you primed for lunch. And basically, I first want to talk about just some healthy eating basics that I think are important for everybody. Talk a little bit about nutrition and cancer treatment, and then talk about carcinoid syndrome and diet, and just give you some resources for more information. So a lot of people come to me and say, well, how can nutrition help me now that I have this diagnosis or my family member has this diagnosis? And what I always sort of look to first is, number one, help improve treatment tolerance, promote overall health and wellness, support the immune system, that we're hearing more and more about how we might be able to harness that immune system for its effects against neuroendocrine tumors, help with side effect management, and help complement our traditional treatments. So more and more research is looking at how we can use our lifestyle, whether it's nutrition, physical activity, or the mind-body connection to help our treatments work better for us. So a little bit more about improving treatment tolerance. There's actually research to show that good nutrition and people that are adequately nourished during cancer treatment have less complications and infections from their treatment. They have fewer treatment breaks and recover faster from treatments, improve strength and energy, and better survival outcomes. For some, though, this can be really difficult as they go through treatment. So I have this picture of a car driving through a rocky cliff, windy path, and it says, "Careful, this is a tricky stretch of road." So for some people, meeting their basic needs as they go through treatment, just are they getting enough calories, are they getting enough protein, are they getting their basic nutrient needs met, can really be the biggest challenge. For other people, they're able to eat pretty well and stay nourished fairly easily as they go through treatment. So one thing I think is really important to think about is how can you individualize this information to you? And there's a few things that I think when you're thinking about creating your own healthy eating plan to take into account. So first off, we always want to start with a nutrient-rich whole foods diet. So if you can get something from food, you're always going to be able to absorb it better, utilize it better. Food is the best form of nutrition whenever possible. Timing of meals and snacks is another consideration. So for some people, that just means, are you eating at regular times throughout the day? For some people that are having a very hard time eating, that might mean, are you eating small, frequent meals so that you can get more nutrients throughout the day? Are you drinking plenty of fluids? And then again, sort of looking at, there is no one-size-fits-all approach. There is no cancer diet that's going to fit everybody's needs. So you have to think about your individual food preferences, your cultural food preferences, your individual needs, how you might be different because of a surgery that you've had than, the advice that your friend who had cancer, how maybe their nutrient needs were quite different than yours. And how easy do you need your food prepared? Are you a gourmet cook, or do you have a gourmet cook in your household that can help you with this stuff? Or do you need to look for things that are easier because you're fatigued and tired and you don't really have a great support system? So I just always look at that as thinking about how you can create your own individual plan. But sort of looking at healthy eating basics, the American Institute for Cancer Research is a very good organization that is dedicated to studying the effects of food, physical activity, and body weight, and how that affects either our risk of cancer or for people that have been diagnosed with cancer, how that might affect their overall quality of life or survival after their diagnosis. And they really come up with these three major recommendations, the number one being choose mostly plant foods, limiting red meat and avoiding processed meats, being physically active every day in any way for 30 minutes or more, and aiming to be a healthy weight throughout life. A lot of people say, well, how does that apply to me? I already have cancer. So I just want to show you, probably can't read all of these 10, they're small, but they have these 10 more detailed recommendations. And some of the individual things they talk about with nutrition, besides being lean or being at a healthy weight and being physically active are that they recommend that in general we avoid sugary drinks and limit consumption of foods that are processed, that have a lot of added sugar or that have a lot of added fats. They also, again, recommend that we limit consumption of red meat, beef, pork, and lamb, and that we actually avoid what we call processed meats. So processed meats are cured meats or salted meats, things that have nitrates or nitrites added to them. They also recommend that we limit alcohol, so 2 drinks a day or less for men and 1 drink a day or less for women. And I just want to point out number 10, because it says after treatment, cancer survivors should follow the recommendations for cancer prevention. So that's where we really tie it into if you've already been diagnosed with cancer, or if you're living with cancer as a chronic disease where your treatment's never going to necessarily end. You want to think about how we can incorporate some of these guidelines to be healthier, even though you're still in treatment, and kind of look at how individually you can incorporate some of these guidelines in. Because the studies that have come out so far with people that have had cancer, primarily looking at breast cancer survivors, prostate cancer, colorectal cancer, have actually shown that following these recommendations may reduce the risk of recurrence or just improve overall quality of life after that diagnosis and treatment. So when they say plant-based diet, I like to use their picture model because I feel like it's an easy way to remember what your plate should look like when you go to lunch today. Sort of thinking about, is your plate 2/3 or more plant foods, so vegetables, fruits, whole grains, and beans, and 1/3 or less coming from animal foods, meat, chicken, dairy products. And it's really not about one magic bullet food. So you'll hear about foods that people say cure cancer or fight cancer, and certainly there are a lot of those foods, but it's really about the whole eating pattern. So it's not only about what are you getting in your body, you're getting more vitamins, minerals, more nutrient-dense foods, but you're also inching out things on your plate like the red meat, like the added sugars and the added fats and the processed foods. So there's no magic bullet food. It's about a whole eating pattern. One of the things that we see that really is a plant-based diet is really our only source for getting these compounds, or what we call phytonutrients. And I have a color wheel up there that has a variety of different colored vegetables and fruits. And they're natural plant compounds that promote health via actions such as having anti-inflammatory effects. So if we're thinking about how we can decrease inflammation from some of the cancer treatments, potentially our diet can be a source of anti-inflammatory action in the body. Antioxidants, so protecting our cells from damage that can lead to cancer cell development, and having an immune boosting effect, so what nutrients can help our immune system work better. It's really these colorful plant compounds that you get when you eat vegetables, fruits, herbs, spices, teas, nuts, seeds, whole grains, beans, and legumes. And so when you hear broccoli as being a very anti-cancer food, or garlic, or turmeric, or berries, it's typically attributed to these phytonutrients or phytochemicals of what the actual anti-cancer action in a cell study displays. And again, like I said, it's really best to obtain these from food sources because there's a synergistic effect. So it's not 1 + 1 when you eat 2 fruits and vegetables together. It's actually 1 + 1 = 6, because a lot of these phytonutrients actually amplify the other's effect, or amplified by, say, vitamin C that comes in that food. So if we can really up our intake of these compounds, we're getting more nutrient density. Another compound or nutrient that we get from our diet that I just wanted to highlight, which isn't necessarily only in plant-based foods, are the omega-3 fatty acids. So we often think of these as our fats that we get from fish. They're essential fats, so you need to get them from your diet, and there's a variety of benefits. So we need them for just our normal cell development, but they're also important for decreasing cancer-related weight loss and fatigue. They, again, support the immune system, and there's benefits for heart health and mood. What are our food sources? So we've got cold water fish, so things like wild salmon, trout, herring, sablefish, and sardines. So all of our little fishy fish tend to be low in mercury and high in omega-3s. It's kind of a win-win situation. Plant sources are also available. So we've got flaxseed. It has to be ground to absorb the omega-3s. Walnuts, pumpkin seeds, and chia seeds, which are kind of a new favorite in the health food stores. And those are fun to add into different smoothies and things like that. So these are good plant sources of omega-3. And how much do you need? Well, it kind of depends, but for your general health, plan to have a plant source daily, so a handful of walnuts or a tablespoon or two of seeds that are high in omega-3, and then 2 servings of a cold water high omega-3 fish should give you an adequate amount of omega-3. If your dietary intake is significantly low, if you don't like any of those nuts or seeds, or you can't eat them for some reason, and you hate fish, well, then we might look at adding a dietary supplement in there. Another nutrient I wanted to just highlight is vitamin D. So vitamin D has been getting a lot of press for the last, say, 10 years in terms of the importance and learning more and more about the important functions of vitamin D. And again, we do know that it has a role in our immune system function. It's important for our normal cell cycle process, so for our cells to go through their regular programmed cell death and life. It's, again, an anti-inflammatory nutrient, and it's important for muscle strength and bone health. Our sources are sunlight, so if we're wearing sunscreen and not out in the sun a lot, we're probably not producing a lot of our own vitamin D. You can get some from fatty fish, eggs, fortified foods. So milk is fortified with vitamin D, as is all of the non-dairy milks these days. So almond milk, rice milk, typically you're going to see some vitamin D added. And then dietary supplements. So how much vitamin D do adults need? Well, the recommended daily amount is about 800 international units of vitamin D, and vitamin D3 is the more absorbable form, but what we're actually finding is that about 75% of Americans don't get enough vitamin D, even if they do get this 800 IUs per day. So ideally, if you can have your vitamin D level, which is a blood test, the 25-hydroxy vitamin D checked, that's the best way to know how much vitamin D you really need individually. And I would definitely point this out if you have any kind of issue with chronic diarrhea or malabsorption, which we'll get into in a minute. Because it's a fat-soluble vitamin, so you're more likely to be low in vitamin D if you're losing some of the nutrients through like regular diarrhea or malabsorption. So just to summarize healthy diet guidelines before we move into some specifics in terms of neuroendocrine tumors and carcinoid syndrome. Again, I would always focus on a balanced diet with a variety of foods, primarily plant-based and nutrient-dense. Choose fruits and vegetables of intense color. So definitely dark leafy greens are going to give you more nutrition than iceberg lettuce. Choose whole grains. So examples would be brown rice, oatmeal, whole grain bread over refined choices. Again, there's a lot more phytonutrients in the whole grain. Lean and plant protein sources, beans, tofu. Choose healthy fats from olive oil, nuts, seeds, avocados. Limit the added sugar and the processed fats, adequate fluids, but avoiding sugary drinks and limiting alcohol, and coupling that with physical activity and maintaining a healthy weight. And then we want to look at how do you need to modify your diet if you're having side effects during treatment or if you have specific considerations. So what are some nutrition considerations that are specific to neuroendocrine tumors? So we've got nutrition-related side effects of treatment. So we've got carcinoid syndrome for a small percentage of people. We've got specific types of tumors or syndromes for cancers like insulinomas or gastrinomas or VIPomas, and then other medical issues that might come into play. So maybe there's diabetes as a comorbidity, or heart disease or kidney disease, and we have to look at specific aspects of how we need to combine the two diseases to make the diet best for both situations. So potential nutrition-related side effects of treatment, again, it's sort of like navigating through an obstacle course, trying to drink a smoothie through an obstacle course is how I think of it a lot of times. So it can be things like nausea, vomiting, constipation, diarrhea, poor appetite, weight loss, weight gain, taste changes, dry mouth, chewing or swallowing difficulties, and fatigue. So fatigue is definitely a chronic side effect for many people that are going through cancer treatment. I'm going to focus on diarrhea because I feel like There's a variety of causes with neuroendocrine tumors, and we don't really have time to talk about all of those side effects. But I wanted to just get in depth into one, just to sort of highlight to you how important it can be to actually have somebody that can help you specifically look at your situation and help you optimize your health. So with neuroendocrine tumors, there can be a variety of causes. It may be caused by carcinoid syndrome. It might be caused by treatments. It might be caused by intestinal surgeries that you've had, gallbladder removal, an intestinal resection, a Whipple procedure. Might be other causes. There's many different avenues why somebody might be getting diarrhea. So what are some of the first things? So if you're having, loose, watery stools on a daily basis, and the definition of diarrhea, there's a variety of definitions, and so I'm not going to go too much into depth, but typically it's going to be watery stools, frequent stools, more than 3 or 4 a day. And there's a few other, kind of definitions that we can look at. But the first thing I would look at is replacing fluid and electrolytes. So you're losing fluid if you're having diarrhea. So sipping on fluids and making sure that you're getting that 8 to 10 cups of clear liquids a day to help replenish what you might be losing. Looking at electrolytes. So electrolytes are things like potassium and sodium that we actually lose when we have diarrhea, and we can actually develop low potassium levels, low sodium levels, which can be very, dangerous. So looking at how we can replace that. So potassium is found in baked potatoes, coconut water, soy milk, melons, vegetables and fruits tend to be really good sources of potassium. So things like spinach, bananas, avocados. You would want to avoid some of those foods on the 3 days before you're taking the certain test, the 5-HIAA test, but otherwise they'd be good to replace electrolytes if you're having diarrhea. And then sodium is really rich in a lot of foods, but some common ways to replace sodium is through broth and some salty snacks like saltines or pretzels. The second thing is, how can you decrease the demands on your intestinal tract? First thing I would suggest is eating small, frequent meals. So the less food you're digesting at one time, the easier it is for your body to process that amount of food. Chewing your food really well is important because there's a lot of digestive enzymes that you can actually kick into gear when you're actually just chewing your food well. You can start breaking that food down before it actually gets into your stomach and gets into your intestine, where you may have harder time absorbing. Avoid things that are irritating to the intestinal tract, so that would be like high doses of magnesium supplements, caffeine, and extreme temperatures. So very hot and very cold foods are going to irritate your intestinal system. So more room temperature, warm foods would be more tolerable. Fatty, greasy foods are hard on your digestive system, so this would not be the time to go get a bacon cheeseburger. This would be the time to eat something simple, like baked chicken, rice, something like that. And concentrated sweets, so very sugary foods can cause diarrhea through sort of an effect where your body has to dilute down that sugar and it'll cause diarrhea. So if you're drinking fruit juices, you'd want to dilute it at least half strength, half water, half juice. And then sugar alcohols are sugar substitutes. So a lot of diabetic or sugar-free food will have sugar alcohols. Those don't get absorbed, so they're going to trigger more irritation to your intestinal tract. More detail, you'd also want to look at lactose. So lactose is the carbohydrate that naturally occurs in dairy product. And even if you've been somebody that could eat dairy products your whole life, a situation where you're getting a certain treatment or you've had a surgery can actually make you become either temporarily or permanently lactose intolerant. So this is something that I would look at in terms of reducing the lactose in your diet, which is really most significant in milk to drink or ice cream. Typically, yogurt is pretty low in lactose because the bacteria has broken that all down. And then looking at maybe lactose-free milk or dairy alternatives like almond milk, rice milk, or using Lactaid or dairy digestive, which is the enzyme that you can take when you're eating a dairy product that will help you break it down. One thing to keep in mind is there's so many dairy alternatives out there on the market these days that it's pretty easy to avoid dairy if you want to at least try and see if it helps with your symptoms. The corner store typically has almond milk these days, so it's pretty easy to find dairy alternatives. The next thing would be looking at gas-forming foods or foods that are very high in insoluble fiber. So gas-forming foods are onions, cabbage, broccoli, cauliflower. I know these are good for us. I'm not saying that I don't want you to eat these, but if they're causing you gas and abdominal cramping, they're probably not the best food for you to eat right now. Maybe you could eat a little bit of baby kale, which is still a cruciferous vegetable, and put it in a smoothie so it's nice and easy to digest. Soft drinks, beans, and chewing gum are also very gas-producing. Then looking at insoluble fiber. So insoluble fiber is all of the skins and seeds in your vegetables and fruits and your grains. And basically it acts like a broom as it moves through your intestinal tract. So it causes food to pass through more quickly and increases loose stools. So really your highest insoluble fiber foods, if you're having diarrhea, would be good to minimize, would be raw, unpeeled fruits and vegetables. So peel your fruit, cook your vegetables, have vegetables in soup form. That's a much easier way to digest. Dried fruits, whole grain breads, cereals, nuts, and seeds. So yes, they're healthy, but they have a lot of insoluble fiber. So if you're having diarrhea, they might just go right through you. Whereas you might be able to do a nut butter, so almond butter instead of a handful of almonds. Then we want to look at choosing what we call low fiber or low residue foods. These actually help bulk your stool up and kind of slow things down so you have time to absorb the nutrients. Examples here would be white rice or congee, which is like a rice porridge that's very effective at helping kind of slow your intestinal tract down. Peeled potatoes, hot cereals like cream of wheat, and then cooked vegetables and fruits, so applesauce, cooked carrots. These are very good foods to help with the situation. And then soluble fiber is the other kind of fiber that we get from our diet, and soluble fiber attracts water and turns to gel in your system, so it slows down digestion, it decreases loose stools. So examples would be oat bran, barley, bananas, applesauce, cooked carrots, and there also are soluble fiber supplements. Benefiber is a common one, but if you're taking a fiber supplement with the hope of it helping with bulking up your stool or reducing diarrhea, you want to make sure that it's 100% soluble fiber. So something like Metamucil, when you look at the ingredients, it's going to say insoluble and soluble fiber, and it's going to be half insoluble and half soluble. So you want a supplement that's all soluble fiber. Lastly, on the diarrhea and nutritional management is depending on the cause of diarrhea, additional medications and supplements may be helpful. So if malabsorption is an issue, maybe from chronic octreotide treatment or after a Whipple surgery, pancreatic enzymes or digestive enzymes may be very effective at reducing or helping manage diarrhea. And for anybody that's taking pancreatic enzymes or has taken them, the one thing I would say is it's kind of a dose-finding mission. So, you get prescribed a base dose to take with your meals, but we really have to talk to you about how you're taking them, when you're taking them, and how to figure out if you should take more or less. So pancreatic enzymes can be really helpful, but there's a large range of how they can be taken, and sometimes they might not seem like they're working, but if you change the way you're taking them or taking the dose, it might help. The other thing is if you've had a gallbladder surgery or part of your ileum, which is part of your small intestine removed, you might have bile acid malabsorption. And there are medications like cholestyramine, which is a bile acid binder, which could help if that is the cause of diarrhea. Bacterial overgrowth, which can happen after surgery or after medication, antibiotic-related or infectious diarrhea, might help with by probiotics, which are healthy bacteria that we can add to our system. If you're taking anti-diarrheal medications on a regular basis, sometimes it actually helps to take them before meals to get the best effect. So there's a lot of tricks of the trade in terms of managing individual side effects. And just to talk about carcinoid syndrome specifically, carcinoid syndrome occurs in a small percentage of people with neuroendocrine tumors, and the symptoms are flushing, sweating, wheezing, diarrhea, abdominal pain. The common triggers are hormone secretions and also certain foods. So if you have symptoms, diet changes may help. So if you're one of those people that has carcinoid syndrome, potentially changing your diet may help manage that. If you don't have carcinoid syndrome or any symptoms from your carcinoid tumor, I would go back to following the healthy eating guidelines. So these are just very individualized to people that are having carcinoid syndrome. One thing I would suggest is just thinking about your uniqueness. So individualize your diet and strategies. So we have these sort of common reported triggers that when they've surveyed people with carcinoid syndrome, but I have to say, when I talk to people, they usually know 3 or 4 things that may really trigger carcinoid syndrome for them in terms of what they're eating, and a lot of the other things may not apply. So if you can actually keep a food and symptom log, you can probably figure out what your own specific triggers are. The most common reported food triggers are large meals, alcohol, tomatoes, fatty meals, coffee and caffeine-containing foods, very spicy foods, and foods that contain a high amount of amines. And amines are compounds that actually are sort of the precursors for adrenaline production, and certain foods have a much higher content of amines. And so if I was going to look at, the amines in your diet, if I sort of looked at everything else and you're still having carcinoid syndrome, I'd start with the foods with the highest amount of amines, because these are probably going to be most likely to trigger carcinoid syndrome. So these are aged cheeses, alcohol, smoked salted fish and meats, yeast extracts. So if you buy like frozen meals or canned soups, sometimes if you look at the ingredients, you'll see yeast extract or hydrolyzed yeast extract, and that's what I'm talking about. And then brewer's yeast. Fermented foods, so tofu, miso, and sauerkraut are fermented foods that have a high amount of amines. A moderate amount of amines may trigger carcinoid syndrome, or symptoms, but not quite as likely. So caffeine, large amounts of caffeine, coffee, colas, chocolate, especially the dark chocolate, it is better for you, but it has higher amount of amines in it. Certain nuts, so peanuts, Brazil nuts, and coconut. Avocado, bananas, raspberries, most soybean products like soy sauce and tempeh, and fava beans. So what does that leave us with? What are the foods that are low in amines if you have carcinoid syndrome? It leaves us with fresh, unprocessed food. So we're left with fresh, lean meat. So instead of eating a processed lunch meat, you'd want fresh roasted turkey. Most vegetables and fruits are very low in amines. For soy products, it would be fresh boiled soybeans like edamame or soy milk. And then for cheeses, it's fresh cheeses that aren't aged: ricotta cheese, mozzarella cheese, cottage cheese, yogurt, and cream cheese. If you have symptoms, some of the things that you can do is look at smaller meals. Again, that's going to tend to cause less of the symptoms. Avoid trigger foods and fatty meals. Increase protein intake. So higher protein will provide additional tryptophan. So when the carcinoid syndrome or carcinoid tumor is kind of using hormones in your body to cause that syndrome, it's sort of robbing your body of some of the amino acids, tryptophan being one of them. So if you eat a higher protein diet, that can help you get adequate tryptophan, which is an essential amino acid. So getting more protein from fish, poultry, lean meats, beans, egg whites, low-fat dairy, whey protein powder, again, individualized to what you tolerate and what your food preferences are. Adding a niacin supplement if you have symptoms, although you'd only want a very low dose of niacin. Again, this helps to prevent a deficiency. If you don't have enough tryptophan, you may not be able to make enough niacin. So just 25 to 50 milligrams of niacin, which is vitamin B3, and you can usually get that in a multivitamin or a very small niacin supplement. Reduce dietary sources of the amines that I mentioned in the previous slide. And then if you are on octreotide therapy, one thing that I would also recommend is monitoring vitamin B12 levels every 6 to 12 months, because there's a potential for a deficiency developing on long-term therapy. So what would a sample meal plan look like for somebody that was having carcinoid syndrome? And this is sort of a healthy eating plan, but it is a little bit higher in protein, and it avoids those amine-containing foods and doesn't have a lot of raw food. So this would be somebody that actually was having carcinoid syndrome. A breakfast would be something like oatmeal with some chopped up almonds, cinnamon, unsweetened applesauce, and an herbal tea. Lunch could be leftovers from dinner, so roasted chicken and roasted vegetables with brown rice, Brown rice is not a very high fiber grain, even though it is a whole grain, so people can tend to tolerate that pretty well. And dinner would be, again, a little bit more protein, so maybe some baked fish, sweet potato, and baked vegetables. Could do like a one-pot meal. And then adding in some snacks so that you can keep your meals smaller. And these would be higher protein snacks, again, because you would need a little bit more protein in your diet, so maybe some Greek yogurt with berries or crackers with hummus, almond butter with a piece of fruit sliced or a hard-boiled egg, and then sipping water throughout the day. So just to summarize, good nutrition is essential to health, so I think we are what we eat is definitely a true statement. And nutrition is a vital component of treatment tolerance, side effect management, and quality of life for neuroendocrine tumor patients. And asked to be referred to a registered dietitian that specializes in oncology nutrition. We have some great dietitians up at UCSF, great dietitians down here at the Stanford Cancer Center, so hopefully you have access to meeting with somebody to talk about your individual needs. And we have a whole bunch of websites, recommended websites, obviously the Caring for Carcinoid, and then some oncologynutrition.org, which is our professional cancer dietitian website, American Institute for Cancer Research, and then some recommended books and cookbooks if you're looking to make some new meals and get some new recipe ideas. So thank you very much for your time, and I don't know if we have any time for questions or, no? Okay, no time for questions. Okay.